All right, y'all, welcome to the latest episode of Beyond the Headline. This is where we pick a specific article and dissect it with subject matter experts. We talk about the piece, analyze, did they get it right? Is there more to dissect? I want to hear from the boots on the ground perspectives who are people working in the fields for these different spaces. So today I'm super excited to talk with the co-founders of Drizzle Health. I'm going to tell you a little bit more about Drizzle Health and both of them, and then I'll kick it over to them to really give them the opportunity to shine. So, Drizzle Health, they are building a low-cost, high-performance diagnostic for infectious diseases in communities, specifically starting with tuberculosis. So, the mission is to create large-scale diagnostics that can be used to test large samples from food, water, environments, and the air to prevent infectious disease outbreaks. I am super excited to dig into this and to learn from y'all because this area is a little bit outside of my scope, but I'm fascinated by it. So I know you guys have so much to say, and I'm excited to hear what you've been doing since Bonolo and I had the pleasure of meeting a couple of years ago in Boston
Yes,
at the TechCrunch conference. So it's nice to see you again, Bonolo, and great to see you,
you too.
Dig. So just let me give the folks a little bit of background about each of your roles. So Bonolo is the co-founder and CTO, leads engineering, clinical, and ops at Drizzle. Under her leadership, Drizzle has secured multiple international patents and earned support from organizations like Open Philanthropy, Mass Challenge, and many others. When Bonolo is not in the lab, she's an avid half marathon runner, scuba diver, and mountaineer, which is so cool. And then
Thank
we've
you.
got Dig, who is also a co-founder, leads product design and commercialization at Drizzle. He has a background in material science, design, biomedical engineering, and most recently was a National Academy of Medicine awardee. Congratulations, Dig. That's so cool. So beyond your bios, beyond, kind of the snapshot of what Drizzle Health is all about, is there anything else that you want folks to know about Drizzle Health?
Um, I think one thing to emphasize here is that like this is not like a singular venture in the sense that like we're trying to create things better for everybody. So
Mhm.
our focus has always been how to make the entire industry kind of better, and I think like that's what we're gonna mostly talk about today.
Amazing.
Yeah.
Thanks for that, Dig. Yeah, I'm excited. So the piece we're going to be talking about today, it was a piece that ran in Forbes last year. It's called Why Food Safety Depends on Every Link in the Supply Chain. It was written by a contributor named Danielle Nierenberg, who's a researcher and writer on global food systems. So this is very much aligned with what y'all are working on in terms of food safety. So I'm really excited to dig in. So the piece starts with some bold statistics. For context, they mentioned that 1 in 10 people worldwide, or about 600 million people, become sick from contaminated food. And that equates to more than 420,000 people losing their lives. So, with so much advances in technology today, I'm curious from y'all's perspective, why is this number still so high?
Yeah, so I think so. First of all, I think like Danielle, like she's written a great article, and if for people who haven't followed her advocacy work, it's really great for the industry, and I think there's something a lot to learn there. So I want to start with the sort of recognizing like how much has been done. Like I know the statistics are very bold, so I want to get there, but um, if you think about it from like a what levers do we have to solve this perspective, there's the policy game, right? Like the Food Safety Modernization Act, that's been genuinely like it's been great. It's sort of positioned the FDA's posture from being reactive to like preventative, and it's this change in philosophy. And very recently the traceability rule sort of came up where like end to end everything is getting tracked now, like certain kinds of leafy greens, cheeses, so on and so forth. Then there's the technology side, right? PCR is really great, really sensitive. There's whole genome sequencing that lets us trace like outbreaks, and that time has come down substantially. It
Mm,
used to be months, weeks, and now we're down to like essentially days, but still weeks, right? And then the producers on their end, like they have sort of also involved third-party audits, some sort of monitoring systems, or supplier verification. So like everybody's trying to do their bit across the board.
hmm
But from a from a broader perspective, what we've kind of gotten better is like responding to things. But so traceback, for example, like I said, is becoming faster, and then recalls are very targeted. But what we're not getting good at is stopping things from happening in the first place, right?
Mm-hmm.
So if you think about detection, for example, like detection is something that happens after something has happened, right?
Mm-hmm.
And prevention is something that, if you want something to happen, if you want something to stop, then it needs to happen in a certain time frame. So I think that's kind of the missing piece. So let me talk about like some specific gaps here. So first of all, the coverage. So if today you imagine lettuce from an entire farm getting processed at a processing plant, there's tons of that. And the testing systems, let's say the state-of-the-art systems that we have, are PCR. And the size of a PCR
Mm-hmm.
machine is roughly this much. So the amount of sample it takes is maybe 2 ml. So how do you fit 2 tons of produce into 2 ml? And then that's kind of like the sampling problem that kind of exists, is that you're not actually, all samples in nature are heterogeneous, like it's not homogeneous, right? So you're
Mm-hmm.
trying to predict where the bacteria might be or where the pathogens might be, and getting them in the system to be able to detect them. That's a huge leap that we are taking right now. So that coverage, for example, right now is less than 0.1% of the actual food that
Wow.
is getting shipped, right?
Wow.
Then the second thing is, even for the tests that are actually taking place, I think we've gotten really good with speed, but there's still a lot to go, right?
Mm-hmm.
Because of this coverage, because of the kind of concentrations of these pathogens exist, they're like very low. So to be able to actually detect them, you have to first enrich them, and then it actually happens. But the problem is that by the time you enrich them, the produce is already out of the plant. So remember, like this is still a manufacturing plant. They want to minimize the time. It's a chain. Like you're trying to minimize the time product is spending on the factory line. So by the time the test results are coming in, a lot of the produce is going out, which is
Mm-hmm.
essentially sort of defeating the purpose of prevention, right? And I think the last I would say is there is a wee bit of incentive problem, right? Like if let's say you detect something, if you say a recall happens, what happens, right? Like from the farm's perspective, it's not good for them. They're going to lose the shipment. They're going to get probably quarantined. They might make headlines. They'll get like some sort of losses that are going to come with that. So there's some sort of penalizing that is happening, right? Like it's an incentive problem at the
Mm-hmm.
end of the day. So like, why should I volunteer this information if it is not helping me? And so I
Yeah.
think like from a technology perspective, that's what you have to solve. It's
Mm-hmm.
not that farms are not trying to detect what's happening on their farms. There's nothing they can do privately. Like if I found out something was wrong with something, I would just put it out and not ship it. But the technology is not there yet. What
Mm-hmm.
we are finding out is after we've shipped it, after it's becoming something, that's when we're able to find out. So I think those are kind of problems that we at Drizzle are trying to solve.
Amazing. Wow, that's all very scary to hear because it sounds like the problem is so daunting with so many
Yeah.
layers to it and very complex. So, thank you for sharing that, kind of like walking us through the different layers of it. It's helpful to conceptualize it. So, I'm curious, is this more so a problem in the US or is it kind of everywhere? I'd love a global view just for some context.
I think like it's fair to say that like about 95% of the global burden does come from lower and middle income countries. But even when we are talking about the US, we are talking about 48 million cases a year, like about 3,000 deaths. That's not marginal, right? Like
Yeah.
end of 2024, we had this debacle at McDonald's where there was an issue with onions in the food, and then that led to I think 104 people getting sick. And from McDonald's perspective, that was about $100 million of losses in some way, like 10% of their market cap was temporarily down, and so on and so forth. And then down the line, you have like these big farms, like Taylor Farms is one of the best when it comes to food security. But even
Mhm.
so, like even with great things, there is a lot of small challenges, like I explained. So even at state-of-the-art places in the US, this is happening at
Mhm.
such a scale. So while the burden is, like let's say less than 5% in the US, the kind of pieces that exist are kind of the same.
Mm. Gotcha. Are there any particular countries where the deaths and the numbers are just severely high and most concerning? You, of course, mentioned lower income countries. Are there any specific ones that you're really kind of looking at and targeting?
So we are targeting the US to begin with, because the system, like there is a lot of push in the system to make this even better. Like I said, the
Mhm.
Traceability Act just came through very recently, and then the Food Modernization Safety Act is also trying to push things in the preventative mode. So I think this is the place to be. Like if we
Mhm.
demonstrate this model here, then I think it is easier to prevent it outside of the country.
Makes sense. Yeah, makes sense. So I want to talk a little bit about kind of where things start, which is, on the farm. So the writer talks about the food safety piece, kind of looking at the healthy soils and positive growing practices as, of course, an important place to start here. So for folks who may not have a, super clear understanding of what typical growing practices may include, could you paint a picture for us of what that looks
Yeah.
like on the farms where we need to be starting? Bonolo,
Yeah.
I'd love to hear from you. Yeah.
Of course. So food safety really does start on the farm. On a typical operation, you'll see farmers preparing and testing their soils, managing their water sources, using fertilizers with pests, training workers on basic hygienes before anything is prepared or harvested. And this is, like Dick said, the ideal picture. But in practice, as with a lot of things, there are still a few gaps. The biggest one from like the ethnographic research and conversations we've had with farmers on the ground is that water quality is a huge issue because most farmers use surface water. So think about like open bodies of waters like dams or streams. And this can get easily contaminated by runoff or wildlife is a major source. So worker hygiene and sanitation can also be inconsistent, but the biggest issue is getting your water quality under control so that eventually, because it's going to be used to grow these plants, so then the contamination would seep in from there. So while good practices does do exist, the level of monitoring and verification and verifying that like the water quality is good, it varies a lot. And the other problem is like Dick mentioned that if you have, let's say, 4,000 gallons of water, it's hard for you to test all 4,000 gallons because you don't know if the contamination is in this little milliliter or in, because just by virtue that like the testing equipment that is used today is requires small volumes like the PCR machine that he mentioned. So
Mhm.
it's hard to get a sample that's representative of the entire body of water that you'll be using to grow your harvest, which again makes it quite challenging to keep up with this level of good practices that are required for food safety. Yeah.
Mm, makes sense. Wow. Okay, so the water piece, it's is
Mhm.
one of the largest kind of challenges, it sounds like.
Yeah,
Yeah.
definitely.
Wow. Okay. So the also just kind of thinking back to the piece, so there's a source quoted from the World Health Organization. They say that more than 200 diseases that we know are carried by food are actually preventable and sometimes even eradicable. So I'm curious. So hearing that, I was kind of shocked. I was like, okay, so if we know we can prevent them, this is still a massive problem. And y'all have done an incredible job, I think painting the picture of what the gaps are those
Mhm.
what you've talked about not being able to get a sample size that covers everything, the water, like, is are those the reasons why this is still a massive problem, or what are some of the challenges when it comes to, again, like eradicating some of these diseases?
So that's a really good point because these, in theory, these foodborne diseases aren't preventable, and some of them could even be eliminated altogether. But the reason it's still such a massive problem comes down to a few realities, right? So the first being that like our food system right now is incredibly complex, especially with globalization. Food travels long distances. It involves multiple handlers, different transports, and even small lapses early on, like contaminated water on a farm or like poor hand hygiene by some of the workers,
Hmm.
could amplify into big outbreaks. The second being that prevention requires consistent execution, and that's hard. So farm processes vary widely in resources. We've seen farm growers that just barely have enough resources, versus those who have like a lot of equipment and can afford more of these proactive and preventative testing measures. So training is a big issue. Infrastructure, having access to fancy equipments that do allow you to catch outbreaks, that soil and water is contaminated earlier on, is not easily accessible for everyone. And even though guidelines do exist, these guidelines are always very ideal and they're not followed everywhere and consistently. So
Mm.
if the US's, for example, if you look behind your citrus, some of them are, they say like imported from Mexico, imported from South Africa. So guidelines in general exist, but like they're not followed the same in Mexico and in South Africa versus a grower and a citrus grower in California.
Mm.
So harmonizing that remains a huge issue.
Mm.
And then the third is that many risks are invisible until it's too late. So microbial contamination can't be seen, it can't be smelled, it's hard to detect unless you do have the actual testing methods. And it is like still a little bit expensive to do. So problems often slip through the cracks until people get sick and then report that, oh, I ate this or I ate that, like Dick mentioned, the contaminated onions. And at that point, then it's too late because they're already sick. So then recalls are being done, which is a more of a reactive measure as opposed to something more preventative and proactive.
Mm.
So yeah, the diseases are preventable, but there's just so many points, and the complex transportation and logistics system makes it just too taxing to be able to catch pathogens at each level. Yeah.
Wow. It's kind of making me think of like, like the whack-a-mole game where you're like one
Yes.
comes up and you're like, okay, I got him. And then like another problem pops up and you're just constantly trying to react to
Yeah.
all these new problems that are popping up. That's what this problem sounds like that game to me.
Yeah.
I can only imagine trying to solve at such mass scale.
It's exactly like that. Yeah.
So you touched on it a little bit within your response there, but kind of shifting to the policy side of things. And Dig, you also mentioned this a little bit in your earlier response about some newer policies that are, trending in the right direction, working in everyone's favor. So they talk about the policymaking and global cooperation as being the most urgent need in order to really address food safety. I'm curious, Dig, do you agree? And are there any other like kinds of policies that are absolutely critical in order to address this issue?
So I think my thinking on this is like everybody tries to solve the problem with the tools that they kind of have. So
Mm,
people who are like, doing policy will try to solve it through policy. People who are doing technology try to solve it through technology, and that's why we end up with, But so to me, like it's the same thing. Like they had both have to kind of work together. And then
mm,
uh like I mentioned, for example, like the Food Safety Modernization Act, it's a step in the right direction. It's really great, like the way it's changed from like the last decade or so, right?
mhm,
But it's not the only lever. Like say, for example, like when I mentioned the incentive structure problem, right? What happens when you do find something? If you don't have a good answer to that, then no matter how good the technology gets, people will find a way around it, right?
mm,
So the technology and the policy kind of have to work together in the sense that it should the infrastructure we're trying to get at these farms should come from not from mandates, but kind of incentives, the right kind
mm,
of aligned incentives that sort of have to exist, right? So
mm,
one of the things, for example, where I mentioned was that the problems are not getting detected early enough. If we are able to build the technology that, as it can test foods without enrichment and can actually, return results before produce leaves the plant, then sort of putting a policy in place of like testing everything kind of makes sense. But if
mm,
that doesn't exist, then the other also kind of, it's kind of toothless, right?
mm,
So that's like one thing. If you look at the field at large, a lot of the tools that we have today in food safety are sort of borrowed from the clinical side of things, like clinical samples where human samples are small. There are different kind of samples, but in food, we're dealing with an entirely different volume type of sample, and I think like that's where the disconnect kind of comes in. I think one
mm,
other thing that I have seen is that there's a growing One Health kind of a framework that's coming into picture, but largely people are still kind of siloed in how they're viewing policy, right? Like the TB
Mm,
people kind of talk to the TB people, the food safety talk to the food
Mhm.
safety people. But
mhm,
if you think about it, like food safety today in the US is an issue because how good of a distribution system, like Bonolo mentioned, the
mhm,
food has in the US, right? Like you start from one plant in Iowa and then it just go through Baltimore, like the way like how fast it's getting and like how distributed that is. So because of that network, right? Like you're not just thinking about food safety. It's the same places where you would, for example, think about zoonotic spillovers or AMR or these other
mhm,
problems that have also happen at farms. So I think
mhm,
like bringing that dimension is going to create the right kind of funding mechanisms and sort of the right purview of incentives that can be aligned for different kinds of people in the system. Because everybody's trying to, at the end of the day, create safety for end users. And I
mhm,
think like that kind of gets in the way. I think more immediately, I would like to see, better data sharing kind of frameworks where
mhm,
there's informal, information exchange between farms in an area or like in a state. But I think if it was more formal, I think that would be great.
mhm,
Then, like I said, the liability structures, like they should reward early detection as opposed to penalize early
mhm,
detection. And I think like the last would be the funding mechanisms that we sort of have. So a
mhm,
quick example would be like the national wastewater surveillance system, right? Like that was built during COVID for COVID purposes, but now it's coming to an end of its funding because that was built off of COVID funding and not into the
mhm,
system. Similarly, I think it was Gene Tracker or something that was done for food. And it's come down by the CDC, and then it's come down from 8 pathogens to tracking 2 pathogens in the food system. So I think like the policy piece also has to strengthen the federal and state
Mhm.
funding mechanisms that are doing
mhm,
some sort of this surveillance work.
mhm. Appreciate that breakdown. Yeah, it sounds like as always, I mean, more collaboration when people are working in silos on their different pieces. There are always going to be challenges, and you do a great job kind of bringing it all together. And I think emphasizing the piece about, picking your head up, communicating with the other farmers, communicating with the other, funding groups, and kind of bring everybody together. Because again, I always say the melding of the minds too is so
Yes.
important when you're working to solve really complicated problems like this.
Yeah,
So
no, it's I think like I heard somewhere like there's only drama when there are two right people. Like it was right and wrong, it'll be okay, but everybody's trying to do the right thing, and that's why there's drama.
exactly, I love it. It's so true. So, I would love to hear y'all's perspective, just thinking about kind of breaking down the different challenges we're talking about here. So, we have like the detecting contamination and then also like the larger problem of like preventing illnesses. What are the difference between those two pieces?
I think that's the like kind of like the crux of the problem here, right? Like for detection, like I said, detection just means that something is there, and then you find out that it's there, right?
Mhm,
So a lot of times that happens after the fact. So um, let me go back to like for example like the wastewater surveillance system that was built for COVID, right? You see virus or viral load in the wastewater, right? And that's what you're measuring. That means that like the actual events happened like 2 weeks ago somewhere
mhm,
else, and that's how it showed up, right? And
mhm,
that's also kind of what's playing out in food safety. So if the results are coming much later after the fact that the food has been shipped or even in some cases consumed, then it's kind of too late to do that, right? So even though you're detecting, it's not just the detection that matters, it's when and the speed of the detection that matters, right? So if you
mhm,
put the detection much later in the chain, it kind of is not useless from a containment point of view or from a prevention point of view. From a prevention point of view, you want to know as soon as possible for what if something bad has happened in the value chain before it sort of proliferates, right?
mhm,
We live in a system where a lot of these food products are now composite products. Like for example, if you have peanuts, it becomes a jam, and it gets consumed in a very different way at a restaurant. So it cascades very, very quickly. And so
mhm,
you want to find out as soon as something happens not down the line when a lot of quality checks are in place, right?
Hmm.
So that's I feel like that is like the biggest difference between just detection and
Hmm.
prevention. So for prevention, what you're basically trying to do is going to the source, right?
Hmm.
You want to see where is the contamination originating, like if it's at the farm or if it's at the processing plant. Uh,
Hmm.
we focus on processing plant because a lot of different farms put their it's the bottleneck basically for distribution. So if
Hmm.
you detect something at the bottleneck, it's easier. But I think like going to the source is very important. Speed is very important when it comes to prevention. Like I said, if you should not be waiting a week to test, you should be waiting maybe a few hours and you should be returning that result. Then comprehensive sample. That's I think like that has been our whole spiel this whole time. That like if you are if you're predicting how many bacteria are in a, let's say for example in a lettuce lot, then that should be based on actual testing as
Hmm.
opposed to some sort of statistical mechanism.
Hmm.
To take like 1 ml out of 1,000 liter sample is very, very ambitious, I would think,
Hmm.
to predict any sort of downstream, contamination. So I think like that paradigm shift kind of has to happen, where we want it's already moving with the Food Safety Modernization Act in the direction of traceability. But now we
Hmm.
need to move it to closer and closer. And to get it closer and closer, I think we need to both work on the technology and sort of the incentive assignment or the alignment of the funding piece.
Hmm. Amazing. Well, this all kind of bleeds into me wanting to hear more about specifically what's going on at Drizzle Health. And so I'd love
Right.
to hear what y'all are working on, of course, to, address this problem and of course to decrease the risks of recall. So yeah, tell me more about what you're working on right now in the developments. Since we met
Yeah.
Bonolo, several years
Yes.
ago, I'm sure things have changed quite a bit.
Yeah. So when we first made at TechCrunch, we were solely focused on just tuberculosis. And part of the realization that we came to, like Dick mentioned, is that everybody's working in silos. But like the way we are dealing with the TB problem is not unique to TB. Some of these learnings and lessons can be applied to food safety because tuberculosis is a very heterogeneous sample. It's a lower respiratory sample, so it has like epithelial cell cheek cells and other things. So what we learned from there about how to isolate and selectively concentrate just Mycobacterium tuberculosis helped us because then we also knew sort of like how to look for a needle in a haystack when it comes to food and water safety testing. So yeah, we really focus on catching problems before recalls. And right now, less than a fraction of food gets tested, like we mentioned, which leaves a lot of blind spots. But we came up with our product called the MagnaFlow. So it has a polymer surface which selectively adheres to Salmonella or E. coli or different pathogens of interest. And using that, it basically acts like a magnet. So now you can imagine the gallons of wash water from washing all the lettuce that has just come out from a farmer. You run it through our MagnaFlow, and then this will capture all of that because if you can imagine like a magnet, so it has all these polymers on the surface and it captures that. And now you have a sample that's more representative of the entire lot because you pass the entire all the wash water through this. And now when you test this, if it is really high, then you have every right and can now more confidently flag this lot and be like, okay, let me isolate it and either do more testing or maybe this needs to be cooked down a bit more so that the E. coli can be killed or as opposed to eating it fresh. So this is the types of stuff that we are working on at Drizzle. And then it makes testing both accurate and affordable. So producers can check more batches more often and samples that are representative of contaminations of the whole lot, as opposed to a few sporadic samples can now be used to test batches, not just at processing plants, but also we are working on like scaling it down to like getting it at the source, like Dick mentioned. But yeah, so we've designed everything to be simple enough to get it right on the farm and also in the factory and so that safety becomes a part of everybody's workflow as opposed to the way it is right now, which is whack-a-mole or an afterthought. Yeah, so that's what we're working on.
That's amazing. That's amazing. I'm curious, the magnet piece, is that something that's unique to y'all, or is that been leveraged with this kind of testing previously, that type of technology?
So the polymer is Drizzle's proprietary technology. This is unique to us, and this is similar to what we used in the TB field initially. Yeah.
Okay. Wow, that's fascinating.
So
Very
we're
cool.
solving the sampling piece as opposed to a better PCR because, like Dick mentioned, there are PCRs and other testing methods that are quite good in terms of their sensitivity and specificity, but they always say garbage in, garbage out. So even if you have a really good testing device, if you feed it garbage, you're gonna get a bad result anyways. Yeah.
Yeah. Tig, anything to add to that? Maybe in terms of the, why this is so, why the what y'all have created is such a game changer for, for farms, maybe specifically.
Yeah, so I think Bonolo already kind of covered it, but the whole thing has been like the transition, for example, from TB happened because we observed when we took like the 20,000 foot view and we like, okay, every field, like whether it's food, whether it's typhoid, whether it's TB, everybody's suffering from the same kind of problem. And like the test developers are doing great with like developing more and more sensitive tests, but nobody's kind of focused on what kind of input is going into these tests. And
Mm,
it's very, very evident, like I said, in food safety across the food system in the US, where it's very sensitive. They're trying to do all of the great things, but the response has gotten better, but the
mm,
number of incidents have not. And this
mm,
is kind of what we've sort of seen in TB, in global health, also, where like a lot of systems, their response has gotten really great at due to like all of these detection technologies. But because the input is not so great, because the access is not so great, because they're not close to the source, prevention is not happening. And if
mm.
prevention doesn't happen, the number of new cases does not sort of, get better. And that's also the case in food safety.
Of course. I just want to thank y'all so much. I'm so grateful for you taking the time to educate me and hopefully some of our viewers and listeners as well about this issue. I don't think that a lot of us think about it. We see on TV, blah blah blah, lettuce recalled, and you don't think about everything behind the scenes and all the different steps. For me, it's really been eye-opening to better understand the various complexities and the gaps that exist here. So next time I see one of those headlines, I'm going to be thinking about y'all and everything that you're doing to prevent this from happening and taking on such a huge problem. So kudos to y'all. And again, thank you for taking the time. I'd love to, tell our readers if folks want to learn more about what you're working on at Drizzle Health, where can they follow you? How can they, kind of stay updated with what you're working on?
Sure. So anyone is free to follow us on LinkedIn. Just Drizzle Health. Two separate words is the name of our company, as well as you can feel free to contact us at info@drizzlehealth.com.
Perfect. I will we'll make sure to drop the links and everything too when we post the
Yes.
episode. But Bonolo, Dig, thank you both so much, and we'll see you next time.
For having us.
Thank you so much.